guys. Let's start. Please collect the voting pad quickly because once it starts, then you can't get enrolled. Okay. Uh, shall we start the question? Two of them can come here. Display, question display. Okay, so this will be the trial question. Which of the following diseases is most likely to be associated with HLA A29 surface antigen? Ankylosing spondylitis? Who said that? When they have to press? Navneet? You have to press it. Okay? Very good. Birdshot retinochoroidopathy. Fantastic. So shall we start the main quiz? 15 questions quickly without wasting much time. What happened? No, it will get, these are all activated ones only.
Green हो जाएगा ना?
Yes. So the MacBook, the iPad, and the Apple Watch, all three are ready. Thank you, AIOS Scientific Committee, Dr. Namrata Sharma Madam, for allowing us to conduct this program. And then I think we'll start with the voting part because people were requesting to start a little late. I can't because 11:25 I have to give back that session. Okay. So shall we go on to the questions straight? Yes. Name the drug causing this. Netarsudil, latanoprost, brimonidine and brinzolamide. Timer start please. Okay, thank you. Can we have the next question? Very good, Netarsudil. Which of the following structures is not derived from the neural crest cells? Neural crest cells. Ciliary muscles, corneal endothelium, lens and up. Yes? Lens is derived from the surface ectoderm. The ciliary muscles, corneal endotrabecular meshwork are all derived from the neural crest cells, right? Okay. Yes, C, lens is correct. Next question, please. Which topical eye drop and potential side effect are mismatched? Look at it carefully. Mitomycin C causes clear perforation. Pilocarpine causes brow ache. Epinephrine causes black conjunctival deposit. Cyclosporin decreased tear film production. Time is up. Yes, very good. Cyclosporin, it causes decreased tear because of the restasis is used to treat the inflammatory component of the dry eye and has been shown to increase the conjunctival goblet cells, right? So let's go on to the next question, please. Regarding the fundus photography in the figure, it is unlikely associated, start the timer. It is unlikely to be associated with visual loss, may be associated with hearing loss, acute pancreatitis. Yes, Purshers retinopathy, right? condition, that is complement activating system diseases. Which are those? One of that is acute pancreatitis, right? So after pancreatic injury or inflammation, the trypsin that actually gets activated and the complement system gets activated, and that causes all these problems like coagulation, leukoembolization of the retinal precapillaries, arterioles. So next question, please. Which of the following extraocular muscles is least likely to be affected with a retrobulbar anesthetic block? Superior rectus, superior oblique. Yes, superior oblique. Anyone? Why? Answer quickly. Huh? It is also, then also it is supplied by trochlear nerve. Next question, please. Which of the following intraocular tumors is most radio resistant? Choroidal melanoma, choroidal metastatic carcinoma, large cell lymphoma, retinoblastoma. Very good. Choroidal melanoma doesn't respond to radiotherapy. Next. Which of the following layers of the cornea will stain most with PAS, that is periodic acid shift? Endothelium, Bowman's layer, epithelial wing cells, Descemet's membrane. Okay, so that is Descemet's membrane, right? Because it's the highlight the basement membrane, visualize to use the epithelial basement membrane, Descemet's membrane, both together, constantly laid down by the endothelial cells. Next question, please. Which one of the following retinal lesions is the most classically found in VHL disease, that is von Hippel-Lindau? Capillary hemangioma, cavernous hemangioma, lymphangioma, and miliary aneurysms. Start. Yes? Yes. Good. Retinal capillary hemangioma. Sturge-Weber syndrome. Why it is called as Sturge-Weber? Anything related to that? Strange man lives in the caves. Heard that? Okay. Anyway, because of time, we'll discuss later. Next question, please. Last 4 more questions. Which tear layer contains immunoglobulin A? Timer start, please. Yes, it is aqueous layer. Next question. What are the main contributors to the innervation of the cornea? Short anterior ciliary, long anterior ciliary, short posterociliary, long posterociliary. Start. Yes, very good. How many branches? Anybody? Nearly around 70 to 80 branches, right, of the long posterociliary nerves enter the cornea peripherally. Okay. Next, last 3. Identify the tonometer. Perkins, Pascal, Malkolov, Goldman applanation tonometer. Time starts, please. Yes, it's a Pascal tonometer. Right. Next, last two. All of the following substances found in the anterior chamber are indicative of a disruption of blood aqueous barrier. Pigment, fibrin, white blood cells, red blood cells. Start. Very good. Because blood aqueous barrier maintains the aqueous humor as a cell-free and the protein-free ultrafiltrate, right? Okay. Last two. The extraocular muscle most frequently affected in the thyroid eye disease is which of the following? Medial rectus, inferior rectus, superior rectus, lateral rectus. Yes, it is. Answer is B, that is inferior rectus. Can we have the last question? Which of the following statements about the levator aponeurosis is most likely to be true? It passes anterior to the lacrimal gland, it passes inferior to the lacrimal gland, passes posterior to the lacrimal gland, it passes through the lacrimal gland. Start. Yes, it passes through the lacrimal gland. Thank you very much. So let's have the final score, and then I think the judges is ready with the question. Eminent judge faculty, we have Dr. Anurag Mishra. Please give him a round of applause. A very witty personality in the field of ophthalmology, a very talented personality. And then we have Dr. Reshmin Gandhi, an authority in the field of oculoplasty. Please give him a big round of applause. Then we have a silent man, Dr. Madhukar Shetty, always smiling, always silently violent, because only his brain keeps thinking. And then nobody needs any introduction. I don't want to introduce Dr. Doyle Biswas in any other way. Otherwise, she takes it and she hits very hard. So, excellent teacher, excellent orator. Please give her a big round of applause. Even though she has fractured her leg. Fracture, madam? Sprain. Jo bhi hai. But still, she has volunteered and she has come all the way. Thank you very much for making that effort. And thank you, Microvision, especially for giving us the opportunity to do the voting pad in the very short. Yeah, results put it on the board. Yeah. Everything is transparent. Let's put it on the board. Keypad number 306. Who is keypad number 30? Very good. Please come in the front, madam. And then second we have keypad 315. There are two 306. Okay, please be here, madam. Then can we have 305?
have the 4 semi-finalists here.
Okay, we'll do one thing. We'll take one more as
Yes.
a wildcard entry. The sixth person will be there.
Okay.
Come over.
Works.
And then five, 3 to 5. Who's 3 to 5? Yes, madam. Okay, thank you very much. Please give them a big round of applause. All 5 of them will be outside, right? Only one person will be staying here. No telling them the question, please. Let's play a fair game, right? Because you are not receiving the laptop, they are receiving the laptop. So it's not going to help you in any case. So just on the later part. So please, no any amount of cheating or telling the answers or anything. Let's be fair. And who is the first person? 306. Please write it down. 306 name. Dr. Mehek Gupta, number 1. Number 2, 315. Anshua Kar. Anusha Kar. Okay, 3. Dr. Muskan Gupta.
I'm so sorry. Can you please start from the beginning? I'm so sorry.
No problem. Last week,
Okay.
Okay, Mehek stays here. Rest all will go on. Please keep your mobiles. Give it to your friends if that is okay. Or you can keep it here. That is also. Nothing will happen. Everything is under CCTV. Okay. Please rest all 5 of you. Vinit, Navneet ji, unko copy दिलाइए. And second person, please be ready. Because once it's done, in 3-4 minutes, we'll call. Okay? Navneet will take it. So, okay, so the question will be asked by the judges. That is, the first question will be clinical based question, where it will be on the clinical rounds. And how do they analyze, how do they try to judge the things, how do they approach to the case. That is important. And then the final round will be non-ophthalmic.
So from 5 semi-finalists, we have to select 3 finalists. And then we ask, isn't it right, Srinivas? 3. These are the 5 semi-finalists.
Yeah, these are the 5 semi-finalists.
From there, 6.
Then,
okay, from 6, 3 will be filtered out. 3 will be playing the final round. That's where we ask them non-ophthalmic questions.
okay. So, Anurag sir, please start the question. Please introduce yourself, madam, quickly. Timer,
Good
3
morning,
minutes.
everyone. I'm Dr. Mehek Gupta. I'm from Guru Nanak Eye Center.
Guru Nanak Eye Center. Okay, so how is Jaipur treating you?
So very nicely, sir.
All right. And you are a resident? Which year?
Third year, sir.
Third year
Postgraduate,
resident?
yes.
All right. Okay. So Mehak, here's your question. Here's your situation. There's a 12 years old son of a billionaire, like Rashmin Bhai, has developmental cataract in both eyes. His keratometry readings show 1 diopter of toricity at the corneal plane. Okay? If you are confused, lost anyway, you can ask me to repeat the question. He has never worn glasses though. The parents want him to be completely spectacle free post cataract surgery. How would your approach be?
Sir, in this case, since the child is 12 years, since growing age of the child, so I'll counsel the patient, the parents of the patient, that he can't be spectacle free because at 12 years of age, finding the accurate power of the lens of the patient is not, we cannot calculate accurate power. At that time, we might make patient immetropic, but in future, when the size of the eyeball will increase, then the patient IOL power will be inaccurate and patient will have to wear glasses. So I will counsel the patient about that, parents about that. And also, since the child has 1 diopter of keratometricity, and he hasn't worn glasses, patient might be having meridional amblyopia, but the patient has developmental cataract, so patient might be having amblyopia because of that also. So I will tell the patient that maybe with specs also he will not be able to gain full vision post-operatively. So I think counseling plays a very good role in this, And also, since we are operating a patient, a pediatric patient, so I will tell about the complications also to the patient, to the parents. He might go for IOL exchange in the future. There might be a possibility of developing glaucoma post-operatively later on. And then, of course, risk of PCO and need for ear cap surgery.
So what you're saying is you will essentially counter-counsel them and ask them or request them to reverse their request to you. You will, at any stage, at any cost, you're not even planning to make him spectacle free. That's what you're saying.
Sir, I will try to make him spectacle free at that point of time, but maybe in future he might need spectacles. So I will tell the patient at that time he might need spectacles later on. And for multifocal IOLs, which we can consider, but in pediatric age group, since multifocal IOL decrease contrast and patient is not able to drive properly in night time, so I will not prefer to consider in a child.
Over to you. Anything else? Okay, so just for the knowledge of yours, the other participants and the audience here, we are not judging whether the answer she has given is right to us or not. We are judging the approach. We are judging the scenario reading ability of a person who is into her residency. We are not expecting you to have experience enough to answer this question correctly. These are tricky questions, and we understand that. All right? Thank you so much. Well done.
Thank you very much. Next, you can be seated. Can we call Ansua, Nishant? Anusua.
We will, Shri, just a moment.
Yeah.
No,
So, you can try to make it within 100 now. Again, every round you can make it within. Based on, as he said, based on the talent base.
So I have drawn 3 columns here, sir.
Practicality and how is the clinical implications which they brought. Overall scoring.
The confidence, the clarity, and then the discussion. Whatever, I mean, with what.
And the
what
most
is the,
important has
ability
to be
discuss the case
the
with?
X factor.
The
It
X
comes
factor.
in the last round.
That's the last round.
Okay, please introduce
we'll
yourself quickly.
Mark them out of 30 as of now. Okay, 10 for each column. Discussion, clarity, confidence.
Good morning, everyone. I'm Dr. Anushwa Kaur. I'm from third year junior resident at AIMS Nagpur.
Yeah. Anusua Kar. Okay. Question for the judges, please.
Hi, morning, Anuswa. So, your question is about a patient, a 12-year-old patient who belongs to a billionaire family, and he has come with developmental cataract in both eyes. Okay, so that's number one. His keratometry reading shows that there is a 1 degree of cylinder, toricity on cornea. He has never worn glasses. Okay? And now parents want him to be completely spectacle free post cataract surgery. So you have a 12-year-old person from a billionaire family, astigmatism of 1, and parents insist that he should be spectacle free post cataract surgery. How would you counsel?
Sir, taking the suture along the axis of the cylinder can flatten that axis. So that can be done in the surgical steps.
No, so a patient is in front of you in the clinic, and now this is what they have demanded, saying that yes, go ahead with the cataract surgery, and I want the kid to be spectacle free. So first is counseling, and then we'll talk about the surgery.
So first I'll tell that as the child is 12-year-old, there can be changes as he goes forward. Keratometry readings can change. So any residual power that is left behind after the surgery, we can tackle with contact lenses.
On the mics. So please switch on the mics.
What would you counsel the parents for? Because the parents are more interested rather than the child, that this child should be spectacle free. How would you tell this to the parents, what would be the final result in your expectation? Will you assure them that yes, the child will be spectacle free, or what would be the approximate result?
I'll tell the parents that exactly uh, like complete emetropia may not be achieved, and I will counsel regarding contact lens that if the child doesn't want spectacle, then we can go ahead with the contact lens. So, like, it will not be that the child will be wearing spectacle, but any residual power, we can go ahead with the contact lens. And also regarding the advantages and disadvantages of contact lens, I'll counsel regarding that.
Why not spectacles?
Like regarding spectacle also, but as they are not willing to go ahead with the spectacle, that's why I'll.
Contact lens is an option. Okay, fine.
Anything from you?
So, thank you, Anushwa.
Thank you.
You can take your seat. And I think the next speaker is Muskan Gupta.
Dr. Muskan, please. The farthest microphone, please. Yes, sir. The question.
Yeah, this child of a, well, too many billionaires around, child of a rich parents who has cataract in both eyes, 12-year-old. So they need cataract surgery and they want the child to be spectacle free. So how would you explain to the patients?
The corneal toricity.
Pardon? Yeah.
The corneal toricity.
Yeah.
Astigmatism.
How much did you say?
One degree.
Yeah.
One diopter, sorry.
One diopter, cylindrical power is also there. So how would you counsel the parents so that they have realistic expectations after the surgery, for cataract in a 12-year-old child?
Did you get the question or do you want us to repeat it?
No. Can you please?
So summing up, it's a 12 years old child born to a very, very affluent family. He has a developmental cataract in both eyes. There is a corneal astigmatism, a corneal toricity of one diopter, and he has never worn glasses. But his parents want him to be completely spectacle free post cataract surgery. What would your approach be?
I don't have
What would your
I just
approach
was
be?
asked from the audience to come and sit here.
If he belongs to rich family, then I will advise
No.
her to go for toric lens.
He has asked the same thing Rashmin is. I'm also not prepared.
Yeah,
So that's
okay,
why-
carry on. Is that the only thing?
Yeah, everybody's get the same question so that how they
So
respond.
I think multiple points to consider
Then
that
ask the
it's a
question.
12-year-old kid. You spoke about the richness, but 12-year-old kid, developmental cataract, and one diopter of corneal toricity. Would you like to sort of reconsider?
It's one diopter only.
Yeah.
Oh, okay.
Completely spectacle free. Total freedom from glasses is what they desire.
12-year-old with congenital cataract. Parents want glasses.
I will adjust that power into lens itself.
Okay.
So I have come with a kid, and I'll say, okay, doctor, so you're going to put a toric lens. So will my kid be completely glass free now forever, or what would be the likely short term?
No, because that's growing eye, so power can change later.
So that's exactly what the question is. How would you approach?
Sir, so I won't guarantee that it would be a spectacle free. Child has to use glass because his axial length will be growing.
Okay. Anything else?
And near vision too. They'll have have to wear glasses for near vision also.
So essentially what you're saying is you'll bluntly tell them on the face that you've come to with unrealistic expectations. Please modify your thoughts. This is not the way it goes
Yes,
in
sir.
the real world. You agree with me?
Sir,
Add to that
Yeah,
the
whatever.
fact that you may have him as your neighbor in the next clinic.
Yeah.
And the parents of the patient are billionaires. Think everything.
It's a straightforward thing. Don't tell this
It's
thing.
absolutely nothing. I mean, it's just we're just trying to prep you for the future. That's it. Which year are you in, Muskan? Third year? Okay, third year residency. Okay, that's great. That's all we have for you. Thank you so much.
Yeah.
Well done. Please have your seat.
Next we have Kurthana. Dr. Kurthana Kasi.
Kurthana. Can you come with your name again, please?
My name is Dr. Kirtana Kasi.
Kirtana.
Kirtana. Well, blame it on Srinivas's handwriting. It's terrible.
There always has to be a reason. when she
Everyone knows
falters.
doctors have bad handwriting. It's a known thing. Absolutely.
Duel, question to her. Question to her.
No. You tell her the rest of the story, then I'll tell you the question. The same case.
Okay. All right. I'll read out the situation to
Yeah.
her. All right, Kirtana, you are in third year again?
Yes, sir.
Third year resident. Which college?
RP Center Ames.
So you have a 12 years old kid walking into your office who happens to be the son of a billionaire. Okay. He has developmental cataract in both his eyes, has never worn glasses, and while doing biometry you found that the keratometric readings show that he has a 1 diopter of toricity in the cornea. The parents want you to render him completely spectacle free post cataract surgery. What would your approach be?
So obviously you would do the cataract surgery. You're not going to leave him there. But to make him completely spectacle free, would you consider doing refractive surgery after that? If yes, if no, why?
I would not consider doing refractive surgery at the tender age of 12 years because most of the stabilization of parameters happen around 21 to 25. So at least we have to wait for that. So we should not do refractive surgery in that case. And moreover, I think we should counsel the patients that exactly emmetropic will not be possible after the surgery. There is a possibility that the patient might require, if we implant a monofocal or an enhanced monofocal, even then near vision glasses might be required for most of the activities as a 12-year-old. So I would rather approach this by counseling the parents that it is not advisable for a child of this age to become completely spectacle free, and whatever residual refraction comes, we will treat that accordingly, and refractive surgery they'll have to wait at least until 21.
So you're restricting yourself to monofocals and enhanced monos. You're not going beyond that.
Yes, sir. I think for a child, I think I would prefer an enhanced monofocal.
Why?
We do not know what kind of problems they might develop later on. So suppose suppose this child ends up having diabetes later on and complicated diabetic changes later on, then implanting a multifocal lens will lead to problems later on. So I think I would be erring on the safer side.
Would you consider a toric lens for this patient?
Toric lens can be considered, sir, I think.
Can be or should be.
The
Is that-
toricity can change later on depending upon other factors. So I think right now I would still go for a monofocal. With age, the corneal parameters change, the anterior and the posterior curvature also changes with age. So there is with the rule and the against the rule. The with the rule keeps progressing to and against the rule of the. So later on it will change. So I will go for a monofocal or enhanced monofocal, not a toric.
Thank you. You can take a seat.
Can we have the next contestant, please?
Dr. Lavina Paryani, please. So after this, the judges will tabulate.
There are two left, Sri. There are two left.
Yeah. After these two, then we'll go to the final round.
After this
It will
one.
be completely non-ophthalmic.
You are?
Lavina Paryani.
Lavina.
Yes.
Can you spell that for me?
Lavina.
So Lavina, you have a situation where you are seeing a 12-year-old kid from a very rich family, and he has been brought to you for the management of developmental cataract in both the eyes. The family, who is very rich, are insistent that the kid should be completely spectacle free following cataract surgery. In addition to developmental cataract, the kid also has one diopter of toricity at the corneal plane. So how would you proceed? 12-year-old developmental cataract, one diopter of toricity, and the parents, who are very rich, want kid to be completely spectacle free.
Firstly, we'll put an IOL with complete spherical correction. And
So there are several layers, right? Developmental cataract management, the expectations of the parents, and one diopter of
toricity. We can do a phacoemulsification with intraocular lens placement with posterior capsular excess, with posterior capsulotomy with anterior vitrectomy. Because the
what lens would you choose?
A spherical lens or a toric lens? What's your choice?
So the spherical lens, because the child is still in his growing age, and like the axial length and the corneal curvature is yet to get his complete measurements in size. So even if he put a toric IOL, then he has to wear a number. He might have to wear a number going on. So a spherical IOL is something we should go with.
By putting a toric, he might. By putting a non-toric, he will. What would you choose?
So he will in both cases, sir.
How would you? All right, okay. So you were saying that you will implant a monofocal IOL, which is a non-toric.
Yes, sir.
So you're not addressing the wishes of the parents at all. How would you approach the parents then? Because they've come to you with an expectation.
So firstly, we'll explain this same fact that as the child is in growing age, the number is yet to, the number will change at least till 21 years. And for near, he has to use glasses after the surgery or a contact lens if more power is there.
Yeah.
Can we have the next participant in, please?
Thank you.
Thank you. Well done. Sudiksha. Can you please press the microphone down to match your height? Sir.
I think you are more communicative, please. No, at the same thing. I mean, it will be the same.
Did you hear a mumble coming from your neighborhood? All right. Sudiksha, which year are you in?
I'm in third year.
Third year? Where are you from?
I'm studying from Mysore Medical College.
Mysuru.
Oh, yes.
Okay. So, what's the difference in temperature from down south to up north?
It's really hot and arid here compared to my place.
Okay. Good. So, we have a clinical situation for you. There's a 12 years old patient who is kid, who has come to your office, walked into your office, accompanied by his father, who is very wealthy, stinking rich, as they call it. He has a developmental cataract, both eyes, and on measurements, the corneal meridia show that he has a 1 diopter of toricity at the corneal plane, but he has never worn glasses. But now his parents want him to be completely, since he has not worn glasses ever, so they want him to remain like that, not wear glasses at all, following cataract surgery. What would your approach be?
Now he's 12-year-old.
Yes.
So now, yeah, he will undergo cataract surgery now.
Can you
Yes.
speak into the mic?
Yes.
Voice is coming over.
Now, he will undergo cataract surgery for both
Yes.
the eyes. But I would like to convince the parents that let him wait for a few more years and then he can undergo a refractive surgery. I mean, his refraction will be unstable for a few more years. And I can convince the parents that let him wear glasses for a few years, and then once he's 21, he can undergo refractive surgery.
So your approach is cataract surgery now, refractive surgery to be done later,
Yes.
and you will counsel for both in that setting.
Yes.
So right now he's
Only cataract.
going to have to wear glasses.
Yes.
After a few years, you'll withdraw the distance. The near will still be there.
Yes.
Am I right about that? Okay.
Yeah. Would you recommend a toric lens or a spherical lens only? For the cylinder.
Yes. I would recommend a spherical lens.
Okay.
And what do you think would be the visual improvement? Would you expect him with a spherical lens to come back to normal vision following surgery, or are there any hindrances to
It won't come back to 6.6.
reason? I mean, probable reasons.
He has a cylindrical. So
You know, all the participants are here now. We have all of you, right? Did you even for a moment harp on the fact that the child has never worn glasses? We're through with you, by the way. Okay, you can sit there if you wish. Is she? Are we through with her?
Yes.
So I'm done. Please compute faster. Maybe the child never worn glasses because he never needed to wear glasses. He never needed it. Maybe he had a perfect 6.6 before developing the developmental cataract. And how is that possible when the child has a 1 diopter of toricity in the cornea now? There are two reasons. Somebody mentioned beautifully, actually, I really like that, posterior corneal astigmatism, and with the rule and against the rule. Maybe it was being compensated by the posterior corneal astigmatism, and the resultant astigmatism was not much. The other reason could be, which is even more important, a lenticular astigmatism, which was neutralizing the corneal astigmatism, and the total output was 0 or close to it. Now, when you're removing the lenticular astigmatism by doing a cataract surgery, the toricity will come. So I'm sorry, but I think majority of you stuck to spherical non-toric IOLs. The answer should have been, Rashmin bhai. The answer should have been, that's what I'm sure all of us were looking for, was a toric IOL. The focality can be discussed. Mono, tri, EDOF, enhanced. That can be discussed in a lot of aspects, and we don't expect you to come up with the details of all that, but it should have been a toric because at least for one part and for the immediate post-op results, the child will be largely spectacle free. Going to the school, reading funds from the blackboard or whiteboard, cycling, playing, all children play. And I don't know why this thought it sits on your heads quite firmly that after 12, the corneal meridia will change in the adapter. They don't change much after 12. Had it been younger, you might have what you said is right. And you can largely manage these patients without putting a suture to the cornea, to the main incision. So whatever toricity is there, you can consider that to be the final output and then try to neutralize at least on the IOL front. Because remember, the lower order aberrations, when they are corrected closer to the nodal point, the quality of vision is always better. It's not the same as using glasses. Okay? Are we ready with the marks? We'll go to the final round. Any suggestions from the audience who might have topped that round?
Any guesses? Any guesses who might have topped the round? And remember, we are marking on not whether the answer is correct or not, but in the...
The girl from?
RPC, I think she would have topped the second one is the first candidate.
The second speaker?
No,
So your guess?
Second in rank would be the person who spoke first.
Yeah.
The one who spoke first. Okay. Anyone else from the audience wants to take a guess while they are tabulating?
But remember, all of you did well in your own capacities. Is absolutely, talking about remembering our days when we were postgraduates. We did not have the power in the legs to stand before the rostrums or the podiums and speak into the mic. We used to tremble, shiver very hard, and sweats coming from all pores. So you guys are fantastic. I think you deserve a round of applause for your generation. Do we have the results?
Yeah. Well, as Dr. Anurag has said, all of you are winners and you are brilliant. I think I could not have answered half as well as you. And he could not have answered 1/3 as well as you. I'm sure about that. But we do have to have winners. So coming up, there are three people coming up in the third position. We have Dr. Subiksha. Can you stand up, please? Second position, we have Dr. Mehek. And in the very first position, we have Dr. Kirtana. So these are the three people who are going on to the final. Yes. Absolutely. So these are the three people who are going on to the final round. But congratulations to all of them. And it's a very close competition. Marks are very, very close. Yeah.
From our side, the first round of applause goes to the other three candidates. Really fought well, hard, and you deserve all the accolades we can offer you. However, the competition format is such that we will think you can advance to the next round. So, hard luck, but very well done. Really well done. Thank you.
Participation is important.
Yeah. True.
Suggestion. I think that initial hesitation, you should get over it by thinking for a minute so that you correlate your thoughts and then come out with an answer. That was the only thing lacking between all of you. These three scored because they didn't have that initial hesitation.
The next round would be a discussion round. We're asking about, please take your seats and know in any random order one of you can come and stand before the podium. No. They don't, because the questions are not getting repeated.
It's the same, different questions.
The questions are not getting repeated. This round, for your knowledge, is exclusively non-ophthalmic round. What we are judging is the X factor in you. All right? So this is almost similar to a witty kind of discussion and question answer. All right? So this is not going to be, this is one of Doyle's favorite pastimes. In fact, main times, not even pastime. All right? So this is going to be non-ophthalmic. This is going to be a discussion. We've got 15 minutes left before the session ends.
Yes. Ask the other two participants.
No.
They can
That's
stay.
not needed.
They can stay.
They can
That's not needed.
So 5 minutes.
5 minutes is enough. So this is called as the final or the grilling round. All right? So who is ready to be grilled first?
Any order. Please come.
Oh, wonderful. We mark them on a whole, no categories as it is, from say 50, 50. All right?
So it'll be 200 out of 200.
Yeah. Who goes first?
So first, who's first?
Your name, please.
I'm Dr. Kirtana.
Kirtana, yes.
Yeah, Kirtan, how are you? So what do you think about this current Iran war? What is your take on this?
Sir, I think war is something completely avoidable, which should have been avoided by the people in higher positions. They're just playing with the lives of so many people. And they're sitting inside boardrooms and they are creating chaos that reaches far beyond what they can comprehend.
Okay, well said. So we'll come back to a more important question. You are seeing a post-operative patient of your senior colleague, who is also the director of the hospital, and you found out that.
I would go to my senior consultant, whoever had done the case first, without initially revealing anything to the patient per se, and causing any anxiety or fright in them. I would go to the senior consultant, or if they are extremely senior, then someone just below them who are working under them, and report that this has happened. I have examined the patient and this is what I've seen. So sometimes they might not have been aware of it while finishing the case. So it is my duty to report this to them. So I would do
While
that.
the patient waits,
The patient would have to wait, sir. I would just tell them.
go to him and talk to him and come back. The patient.
I would tell the patient there is just something I would like to discuss with my seniors. If you could wait for maybe 10-15 minutes, I'll just be back with you. And I'll inform them. It is our duty to inform. And the final decision ultimately lies with the surgeon who is operated. If they wish to take up the case again for maybe a IL explant or a redialing or whatever, that is their discretion, but it is my duty to inform.
I just have two questions actually. One is, you said senior consultant and extremely senior consultant. How do you distinguish? Does the extremely senior mean, are you trying to imply near senile consultant? I'm just asking.
That's easy. I'm senior and she's extremely senior. Say that.
I would beg to disagree, sir. Doesn't look that way.
Oh my God! Can you please lower your head? Can you please lower your head?
I'm so sorry.
That much
This is
favor.
what AIOS is doing to us. XX preponderance.
You'll get your marks, don't worry.
All right, Kirtana. For the sins you have committed in the last birth and the sin that you've committed just now, God comes down and asks you to sacrifice one of the hands. Which one would it be? And why?
Yeah. Sir, I'm a right dominant person. I would have to, if I had to sacrifice one hand, it would be the left hand. But I would like to keep both my hands. I mean, if there was some way.
For something else.
And you hold the chopper with your mouth. That's doable, I think.
You actually missed a point. I said he has asked to sacrifice one of the hands. I never said he
Whose
has
hand?
asked you to sacrifice one of your hands. Are you married?
No.
You have a boyfriend?
Listen, she's a doctor. She cannot even think evil thoughts like you. Come
No,
on.
but it's
Why
not
will
evil
she even
thoughts.
think
If
of the
God gives me
patient's
this
hand?
option, I would be happy to sacrifice one of my wife's hands.
Sir, is your wife in the audience?
If
She's asking a question, Anurag.
you're not supposed to do that, what's your, have I designed it once to you? No. Yeah, so what was your question?
Is your wife?
She wants to know if your wife is in the audience. No, but
You're surely getting negative from here. I know that.
I apologize, sir.
Well done. Thank you. Yes. Yeah, sorry. So you got one.
Take ophthalmology.
My main options at the end of MBBS were medicine and ophthalmology. And ophthalmology sort of combined both medicine and surgery for me. And I think Indian ophthalmology is doing great stuff. It has a huge presence in the global platform, and I think that was the tipping factor between ophthalmology and medicine. Also, I wanted better work-life balance, which I think Ophthal provides. So, thank you.
Mehak.
So, Mac, what do you think about AI, and do you agree with what is being done with AI now, and do you think it will replace us doctors?
Sir, I think if AI is used in a right way, if AI is used in a right way and judiciously, then yes, it can help us, but it cannot obviously replace doctors. Clinical knowledge is far beyond computer reach. So yes, it makes our help work easier. We can devote time to more better things. So doing more monotonous work can be decreased by AI. Also in far reach periphery areas where maybe doctors cannot reach, AI, various machines where we do screening by AI machines and all can help. So AI cannot replace doctors, but yes, doctors can make use of AI to work better.
All right, one more question. So you're seeing your OPD, it's a very busy OPD, and you get a call from your hospital director that a VIP patient has come in for routine eye checkup, and you have to tend to that VIP patient first. How would you deal with this situation?
Sir, I will ask my senior that yes, I'll see the VIP patient and she can send the VIP patient to my OPD and then I can see that patient.
But you have a full OPD. There are so many patients who've come ahead of him and they're all waiting.
Patient with corneal ulcer or conjunctivitis is waiting.
Sir, I see OPD fast, so I'll see those corneal ulcer patient first. If it's important, then I can see that VIP patient. And I think seeing that VIP patient, one patient before anything else will do no harm because that VIP patient can create ruckus if being delayed or anything else. So.
You are all set for the corporate world. All the best to you.
In your opinion, is marriage relevant in present situation, in your opinion? Earlier it was universal. Now, how relevant is it to achieve happiness in life?
Sir, I think...
Are you married before that?
No.
She
Sir,
said
it's...
good. Stay that way is what she wanted to say.
Sir, I think it's depend on person to person. For some, marriage might be very useful thing for happiness. Achha, sir, for me, I think it's like marriage is not the only thing which will decide my happiness. So, getting married, then also I can be happy. And if I'm not married, then also it's not like that I will be sad. I can be happy. With my career and with all the other things, with my parents and everybody else. So I don't think marriage is very important for happiness.
You receive a call from the Home Ministry, Mehak. You receive a call from the Home Ministry, yes. And it is announced from the Government of India that you hereby appointed as the official ophthalmologist of the Government of Pakistan as a symbol of mutual understanding. You can take your family if you wish. For 3 years. 3 years. Should you wish to refuse, you can start your practice in India, but that will be after 5 years,
If I don't go.
if you don't go. What would your response be?
Sir, seeing the relationship between India and Pakistan, so I will not like to take my family, but maybe I'll consider to go to Pakistan and serve there for
Remember,
3 years.
once it is stamped, then you will be questioned in each and every country. So do you still wish to go?
No, I didn't get it.
Once the Pakistan visa is stamped on your passport, whichever country you go in the West, you will be questioned. Again, re-entering back, again you will be questioned in India. So that's why he's asking you, you still wish to go, but you are a doctor. What oath you have taken?
Sir, to serve people, but doesn't matter whether in India or in Pakistan. So if it's like that, this is the case that I will be questioned everywhere. So I might refuse, but serving there for 3 years just, so I think can be done. But I will not take my parents.
In this situation? See, he said you cannot practice in India for 5 years, right? But she can do free service. You can practice your skill. You'll not get paid in India for 5 years.
No, that's not what I said.
That's what I'm making it.
Every practice is not related to payment. Everybody
I'm
doesn't think
just
like
twisting it. What would you do then?
Ma'am, if I can practice for free in India, then I will choose that over going there.
Okay.
Brilliant.
Thank you. Thank you. So can we have the last participant, please? Dr. Namrata Madam is also here to give away the awards.
What's her name?
Who will be the student of the year, AIOC 2026.
Sudiksha.
Subiksha.
Subiksha, Rahul Gandhi or Narendra Modi?
You can't do that. And be careful. Listen. When you ask that question, move your chair away. Move your chair away. I'm telling you, move your
No,
chair
I would
away.
have answered this question. I would have still vouched for Rahul Gandhi.
Just to
Narendra
be
Modi,
one
yes,
in
it
the
is
crowd.
there, but Rahul Gandhi is not a bad leader.
Just to
People
be
have
one in the
depicted
crowd.
him as a bad leader.
And he says it
Unfortunately
while
not.
keeping one chair distance from Anurag.
Yeah.
My fist can still reach him.
I don't know if there are any supporters over here, and if I answer, then I'm gonna get screwed. But
It's all right. It's what do you think?
Rahul Gandhi, because this been Narendra Modi for so many years. I don't have any specific support for both of them. Maybe we can expect a change. So Rahul Gandhi.
So are you talking about change just for the sake of change? You said he's been there for so many years. So what? You'll bring in anyone who's just because you want a change, just because someone's been there for so many years. Answer carefully and look carefully in the audience before you answer.
Yeah, anti-incumbency also doesn't play all the time.
I meant change in the sense we will have change in ideologies because the person is changing. There can be new thoughts, new opinions in a different person.
So you feel that someone new coming in is going to, the ideology is going to change. So it's for ideological reasons.
Etiology, pathology, mechanism, all of them.
Yes, sir.
What is the single biggest threat to us in future, in the next 10, 15 years, for mankind or for us, not mankind, humankind?
No, I think the threat has already started. We are seeing wars all over. If there is a future, then
What are the threats, 1, 2, 3, in your opinion, which are facing us overall? I'm not talking of individual things, the world, or not the world, humankind. Whatever it is, please.
one is the wars going on right now. That's the major threat that I think. Then the other threats could be, it's just people against people. Nothing else can affect us more than this.
What about climate change?
Climate change has been a threat all over. That is something we can't avoid. But mankind, the actions of mankind is something we can avoid. And that is what I consider
Climate
as...
change is caused by humans.
All right, Sudiksha, you are aboard a ship, a cruise ship. Okay? You've been leisuring.
Yes.
Holiday. The cruise ship meets a storm, mid-ocean. You have one lifeboat left, 2 seats to be occupied, and you're accompanied by your boyfriend, your mother, and your best friend. Who are the 2 people you're going to send across to that place? Her boyfriend, her mother, and her best friend.
And why?
Only 2 can board.
You have to give the reasons why.
I don't have a boyfriend. I'm already married.
Husband.
So that's out of the option.
Husband. Husband,
Your husband.
mother, and a best friend, not mother-in-law. I know you would have not chosen mother-in-law.
What makes you think she'll choose a
No,
husband? I would have first thrown him off the ship.
I'll choose
You don't
me.
have to say that.
I'll choose me and my mother. I mean,
Your best friend and your husband left behind. You'll choose yourself and your mother.
yeah.
Anurag.
I don't need.
You are entitled to what you are choosing.
I think
What a
give you a standing ovation. Actually, Joel would have done the same. I would have done the same as well. Perhaps. Not perhaps, definitely so.
All of us would have done that.
If the best friend, I mean, the one who claims herself to be the best friend, as Joel claims herself to be the best friend I ever had, just to, shoot herself to claim to fame, I would have definitely been the one to leave her behind.
Okay.
Board.
So,
Fantastic.
thank you very much. We have come to the end of it. The AIOS Student of the Year. I request the judges to please tabulate and Nishant and Tejas there to please give them. Let us play the small video till then. Sound. Okay.
Oh, ma'am, I wouldn't give up. I can't give up my pentathlon and my house on fire. हाँ? वो तो हम कर रहे हैं सर. House on fire है. What time is it? आप आ जाना सर.
I'm growing a little exhausted of winning.
And the winner. Winner is always given. The medal is there.
And I must say that all participants did very well. It's not easy to come over here and then, have these random questions thrown at you while you're also in the crosshairs between 2 strong personalities. So, but you did very well. So round of applause for all of you. Well done. Very well.
Okay, I request Namrata Madam to please say a few words about just 2 minutes. We are ending up. Once we give away the prize for the who is the student of the year and why are we doing this, and so kind that scientific committee chairman Namrata Madam has given this opportunity. In fact, it is now being emulated in most of the states across India. It's a potential way to promote the postgraduates. Namrata Madam, please.
Yeah, I think it is a great idea, and I think it is, we owe it to Dr. Srinivas Joshi, who came up with this idea and in fact did it in his own state for many years, and then finally, I think this is the 3rd time we are doing it, Srinivas, the 3rd time that we are doing this Student of the Year. He promises that next time it will be made bigger, and Dr. Nand Kishore has already said that please give a bigger hall. We normally used to give very big halls for this, and I think it is a great program, especially at your level, when the young ophthalmologists need to know what is actually happening. And this is also one channel or one way when you actually walk into the conference. If you did not contest for Student of the Year, if you were not too much bothered about it, you would perhaps never come to the conference also. So I think 2 or 3 programs like the PG capsule, Student of the Year, Teachers of Tomorrow, that is, you can say, a bridge between the students and between the conference per se, because otherwise students really don't bother. And it is very important for each of the students to be given an opportunity to present, because it gives you a different kind of confidence once you stand behind the podium and present. Results are out? Okay. So, thank you, and thank you Srinivas for doing it, and thank you all the
I request all the judges to please come forward. I request Namrata madam. Guys, any guesses who is the AIOS 2026 Student of the Year? The first place goes to... Yes. Yes, Dr. Keertana. Congratulations, Dr. Keertana. So she receives the MacBook, the price of nearly 1 lakh rupees. Dr. Mahek. Thank you everyone. Thank you respected judges. An excellent performance as always by Dr. Anurag Mishra, Dr. Reshmin Gandhi, Dr. Madhukar Reddy sir and Dr. Doel Biswas. They have done a phenomenal job. And thanks to Tejas and Nishant and all the team from MM Joshi Institute, Dr. Shailesh who have been, Dr. Deepthi and everybody who have helped me at the back end in making this SOTI possible. Thank you very much once again. Sorry for the little bit of delay. I request the next IC instructors to please take over. Thank you. Thank you, Namrata madam. Thank you very much.
Thank Srinivas for conceiving this program, for making it happen. Big round of applause, please, for Dr. Srinivas Joshi from all the students and all the audience. Thank you, Srinivas.